Hi, I'm Martina Tierney, Occupational Therapist and Clinical Director at Seating Matters. I'm here today to just talk to you about why I set up Seating Matters in the first instance. Back in the year 2000, I was still working as a health service employee, but I was quite frustrated about the lack of services available to the clients in our area in the northwest part of Northern Ireland. What I found at the beginning was that seating was an area of neglect and something that I wanted to focus on, because even then I could see the impact that poor seating was having on the patients that I was dealing with every day. And I was quite frustrated about the lack of knowledge around this area, and even with my own lack of knowledge. So I made sure that I would educate myself before I would start looking into this problem and helping to educate other people as well. So at that time I was aware that I wasn't a specialist in that area, but I wanted to learn more. So I paid to go and to educate myself, and I went on all courses that were available so that I would become a point where people could come and ask for advice and get good professional help. As I educated myself and went on more courses, I realised the impact that sitting was having on our patients on a day-to-day basis. And most people, including myself, were not really aware of how potentially dangerous it was for our patients sitting in chairs in nursing homes and in their own home. There were many problems, for example, falling out of chairs, sliding from chairs, pressure ulcers developing, restraint in chairs, people being tied into chairs because they were not safe in the chairs. There were so many issues around sitting that really weren't being addressed at that time. As I visited nursing homes and care facilities, I could see that people were sitting very poorly and there was a lack of proper assessment. So I decided that I would set up an assessment centre in the northwest part of Northern Ireland, and at that time I thought I would just service my own community. So at the very beginning I was really just doing very local work and working in our local nursing homes and care homes. But people started to get very interested in what I was doing, and some of my colleagues and people that I had known through the health service started to come to me for advice on seating. So colleagues that I had worked with would come to me then and ask for help and advice on seating. And just throughout the area that I lived in, that grew and grew, so that I was covering the whole of Northern Ireland and the whole of Ireland. After I set up this centre, I discovered that there was a great need for seating, specialised seating. People were in nursing homes and in their own home in seating that was very poor and was causing them a lot of problems. I talked to my husband and my family, and we decided that I had the clinical knowledge of what I wanted for my patients. My husband and my family had the technical knowledge of what they needed to do for their clients. So what we decided to do was we would join forces and have the clinical and the technical knowledge come together and produce equipment, especially specialised chairs, that would meet the needs of my patients. Some of my goals at that time were to get a seating that met the needs of the individual client, but also would meet their long-term needs, so that if they purchased a piece of equipment or a chair today, that would meet their long-term needs. I also wanted to get a chair that was cost effective so that they could value for money, and I wanted to get equipment quickly for the clients, because at that time, and we're going back 16 years, people were waiting 4, 6, 8 or even 10 weeks on a chair after they had been assessed. My family and I were very excited about how we were changing people's lives, the impact that we were having on them. It was just a delight to see people sitting more comfortable. The families were happier, and so we just naturally found that this was something we wanted to show to the rest of the world. One of the reasons why we decided to go across the world and spread the word about Seating Matters was when I was looking for chairs. I travelled the world. I travelled Europe looking for a solution before we decided that we could do this ourselves. I went to Norway, I went to Germany, I went to various countries looking for the solution for my patients, and I couldn't find it. So that is why when we had the solution, we felt we needed to share that with others. So with more education and with developing the Seating Matters chairs, we realised that there was a major improvement in the person's health and well-being using the Seating Matters chairs. We knew deep down that we were doing something very good, but we needed good clinical evidence. We needed someone to support that. So we approached the Ulster University, and with their help, we were the first company ever to do practical clinical trials with good ethical background on specialised seating. And as a result of that research, it really gave me confidence to go further and to know that what we were doing was really having a very positive impact on our patients. I do believe that anybody in the caring professions like occupational therapists, physios, nurses, we all care about our patients. We wouldn't be in this profession if we didn't. So when I would go into a home or into someone's facility and see someone sitting badly, I was just imagining if that was my mother, if that was somebody belonging to me, how would I feel? What would I want done? So that was the driving force behind Seating Matters. It was knowing that we could make a difference. We just didn't want to stand back and withhold that help that we could give other people. So we wanted to spread the word because really it was making such a difference, and it was a very personal journey for me to do that. As I educated myself and as I went on more courses, I realised that what I had been doing for years and years before wasn't exactly right. And I was making mistakes that purely because I didn't know any better. And that's one of the reasons why I feel education is so important. Things like accommodating hamstrings, using tilt and space, having a chair that's adjustable, which prevents people sliding out of chairs, reduces the risk of injury and skin damage. I really felt that there was so much I needed to learn, and that is why education for me is the key, and that's why I promote education, because the more we know, the more help we can give our patients on a day-to-day basis. At Seating Matters, one of the messages I like to get across to my family and to my workforce is that we're always learning, and that although I have come a long way and I feel very confident in the area that I'm now working in, I'm always learning, and I'm learning from you as clinicians, I'm learning from my patients, and I'm learning from other people. There's a huge gap in knowledge within seating, and you shouldn't be afraid to come forward and say that you don't know it, because that really is where you're going to learn. And we provide a lot of training. It's all free of charge, and I don't ever feel that we will ever charge for the training, because it's really important that we get the message out, because the more people that know about seating, the more of an impact we can have very positively on the people that we serve every day. The work that I've done with Ulster University has really shown me that we have a lot more work to do, and there's a lot more education that I want to impart. So even though there's OTs, nurses and physios out there and carers who wouldn't maybe have the knowledge that they need to do proper seating assessments, you shouldn't be afraid to come forward and ask for help. Seating Matters and myself, we will be continually providing education and training in this area, because we see it as a vitally important part of our work. We're not just about providing a product and a solution. We're about educating you and the public and our patients and carers on why it's important to get the seating right. The facilities we have here at Seating Matters now are massively different from when we started. We started round the kitchen table. It was a family business, my husband, my sons and my daughter. And at that time we were just making one chair at a time for our patients. But what hasn't changed is that the patient is still at the centre of Seating Matters. We are always thinking about their comfort, and it's them that drive us to be better every day. My message and my vision for you and for our company is that we educate as many people as possible on the impact of poor seating on our patients and even on our own relatives. My goal is to reach as many patients as possible across the world, so that at their most vulnerable time, and sometimes at the very end stage of their life, that they are sitting comfortably. If you'd like to learn more about why seating matters and about our company, if you'd like some education on seating, please contact us. We are willing to travel anywhere in the world to do training and to provide you with the evidence that you need that seating really does matter.